So next we're going to talk about the autonomic adverse effects that could result from giving antipsychotics. So we would see, we can see autonomic effects resulting from the blockade of the peripheral muscarinic and also the alpha adrenoceptors. So when you block the muscarinic receptor and also the alpha adrenoreceptors, you will see probably unwanted autonomic effects of the drug. And this is more difficult to manage in patients who are older. And with continued therapy, patients might develop tolerance to some of the autonomic effects. Among the older antipsychotic drugs, thioridazine, this drug has the strongest autonomic effect, whereas haloperidol has the weakest. Okay, so this is the weakest. Thioridazine is the strongest when it comes to having autonomic effects. Most of the atypical antipsychotics, the atypical antipsychotics usually have moderate or intermediate autonomic effects. With some drugs, some of the old drugs, for example, like thioridazine, and those phenothiazines, that has got the aliphatic side chains. Example is CPZ, chlorpromazine. Chlorpromazine. So when we use these drugs, they tend to cause atropine-like effect. Atropine-like effects. So if you cannot remember what are the atropine-like effects, go back and try to revise what we have taught previously. So basically, they from top to bottom. So at the mouth, they develop dry mouth, and the intestine, the large intestine, they have constipation. In the bladder, they develop urinary retention. So they cannot pass urine, or they have problems passing urine. And also they might develop visual problems, so problems with vision. So atropine-like effects, blurred vision, dry mouth, constipation, urinary retention, basically parasympathetic effects, parasympathetic effects. And these effects, besides these typical drugs, the older drugs, you might also see it with some of the atypical drugs, So you can see with these effects with even clozapine and the other atypical drugs, Sorry, I could say that most of the atypical drugs also cause these effects, except for those two new drugs, aripiprazole, aripiprazole, Zol, and ziprasidone. Okay, so these are relatively newer drugs. Okay, relative newer drugs, probably about 10, 12 years. Okay, old. And another thing is when you block the muscarinic receptors, okay, what can develop is you can get in the CNS, you can get a toxic confusional state. Okay, so patients become confused, which is not good, especially in the elderly. And again, this is a condition that mimics or is similar to the effects of atropine and also the what we call the tricyclic antidepressant. Okay, so we're going to have another lecture on the tricyclic antidepressants later on. Tricyclic antidepressants. Another important autonomic effect, or probably sometimes the most important autonomic effect, is postural hypotension. Okay, postural hypotension. So your blood pressure goes down, it drops when you change position, okay, from lying to standing. And this is it's more common with the older drugs, okay? So more common with the older drugs, especially the phenothiazines, okay? Phenothiazine, this one, okay? Phenothiazines. It's common to cause, previously, older, it's common to cause postural hypotension. And this is because of the blockade of alpha receptor, okay? So when you block the alpha receptor, you might get postural hypotension. And this is can be dangerous in the elderly because they might fall, okay? So when they fall, so many things can happen, okay? They might just get a bruise or they can get a fracture, okay? Fractured neck of femur, for example, which is very not wanted. Or you can get more severe hemorrhages in the brain, etc. So this is more common among the typical drugs, but among the newer drugs, okay, clozapine, okay, clozapine. So clozapine is quite a naughty drug in a few ways, even though it's useful in the sense that we can give it to patients with resistant schizophrenia. But the problem is clozapine also causes postural hypotension. Okay, and besides clozapine, it's ziprasidone. Okay, even though ziprasidone is a new drug, unfortunately, so there's always a pro and con to a drug, regardless of whether it's new or old. Okay, nothing is perfect. So ziprasidone, new drug, but still, it unfortunately causes postural hypotension or orthostatic hypotension. One more thing with phenothiazines, okay? Phenothiazines also causes failure to ejaculate, okay? Failure to ejaculate. So this is quite a concern, of course, for patients, even though in an Asian setting, they probably will not say it out, okay? But then you have to always consider male patients, sexually active. So if you want to give them phenothiazines, then this might ensue, okay? This is a potential problem that can potentially compromise their degree of compliance to taking the drug, okay? So they might skip the drug every few days or not take it at all because they might think that this is like a permanent thing, so they might just keep the drug. So keep that in mind before you want to prescribe a phenothiazine. Okay, next is the endocrine and metabolic effects. So in these effects, you can see basically four things. Okay, number one is hyperprolactinemia, increase in the prolactin levels. Secondly, gynecomastia. Okay, so you get boobs. Okay, for males, it's a problem. Okay, females, maybe not. Okay, and then we have amenorrhea, galactoria syndrome. Okay, so for females, it might be a concern because they don't have their menses. So many ladies, they are worried when they don't have menses. Okay, but they think it's abnormal, and some of them think it's going to affect them physically, mentally, etc. Okay, so they are worried. And then galactoria, so their nipples secrete milk. Okay, so this can happen in males also. Okay, even men can get galactoria, so it can be embarrassing for them. Okay, because their brow will be wet all the time. And then we have infertility. Okay, which can be a concern and especially in the young and people who are trying to conceive. Okay, so all of this needs to be we need to consult the patients if they are thinking of and it's it's um, it's possible for us to allow them to have children. Then if we are thinking of allowing them to have children, okay, then we have to consider. Okay, consider. I'm sorry, don't consider them. We have to counsel them on this. Okay, counsel them on the fact that they might be infertile if they take this drug. Okay, especially the yeah, so many of the drugs. So basically, these are it's a predictable effect of the when you block the dopamine 2 receptor. Okay, so these are all predictable. These are all expected effects, which is an extension of the pharmacodynamics of the drug. So this one is when you block dopamine 2 in the pituitary gland. And because dopamine, okay, so dopamine actually in the pituitary, when you have dopamine, okay, it's supposed to block off the prolactin secretion. Okay, dopamine is supposed to block off prolactin secretion. So when you block dopamine, so you get extra. Okay, so it's not being suppressed. You have more prolactin being produced. So gynecomastia, amenorrhea, no menses. You have no coming out of your nipples, and then infertility. You become infertile or subfertile. And so this is pronounced, okay, especially with risperidone, which is an atypical drug, or it's a non-classic or a new drug, relatively new, not so new. Okay. And several of the atypical drugs, okay, for example, Clozapine and olanzapine, okay, unfortunately cause weight gain, and hyperglycemia. So this is of course something unwanted, especially in females, young females. Okay, they'll not be happy. They have weight gain and hyperglycemia, but sometimes we still have to give it to them, okay, because probably it's one of the better options for them. Okay, but then we have to monitor their weight. Okay, ask them to exercise, control their diet. Okay, so they might find this a bit challenging. Okay, and of course this can be like worse. Okay, if the patient is pregnant. Okay, so this can be an extra concern if the patient is concerned having weight gain and hypoglycemia. Okay, in the end they might have macrosomic babies and they have to undergo cesarean section or um, other traumatic birth ways. Okay, methods of delivering babies like forceps delivery, all that. So might cause more problems for the mother and for the babies. So in this sense, okay, aripiprazole and ziprasidone